with me next as we talk about digital health. We know that healthcare is going to be increasingly data-driven. I have a very dear friend, Dr. Steve MacFeely, the Chief Statistician Director of Statistics and Data Directorate at OECD, joining us online. Steve, want to hear your thoughts. Last year we launched the movement Data First, AI Later, and you have been the guiding light for data-driven healthcare. Over to you.
Thanks, Rajendra. Good afternoon from the OECD in Paris. It's my great pleasure to join you today. I'm very sorry I can't join you in person, but thanks, Rajendra, for the invitation. So, ladies and gentlemen, the transmission and the spread of disease does not respect borders. And trying to constrain health responses, whether they're routine or emergency, to the confines of man-made or administrative boundaries is futile, and we know it's doomed to failure, and hence the need for multilateral approaches to health. The same can be said of data. Digital data are a globalized resource. They're easily shared, duplicated, traded, and exchanged. And digital data transcend borders and challenge very comforting notions of national sovereignty. And this is why I and many others have been arguing for the need for some sort of international data governance framework. Data, and in particular digital data, contribute to the improvement of health outcomes around the world, either through sharing of scientific knowledge or through informing policy. And data also provide the basis upon which modern LLMs and machine learning models rest, and hence the call, which Rajendra just mentioned, for data first, AI later. So what I'm talking about here is digital data, because digital data are the fuel of digital health. Without digital data, there is no digital health. Data are foundational to this discussion. And furthermore, without data, there can be no artificial intelligence. Without data governance, there can be no AI governance. And without data, there can be no digital health. But digital health in and of themselves are not enough. We require good quality, trustworthy data, because without good quality data and supporting data infrastructure and governance, we cannot realistically expect data to serve the public good, let alone be public goods. So earlier today, we heard the need for three key pillars: technology, politics, and values. So let me add a fourth and call for the need for well-designed data infrastructure. Ladies and gentlemen, there are several types of borders. There are national borders, which I've already alluded to, but there are also sectoral boundaries and sectoral borders. Many determinants of health lay outside the traditional borders of health. So digital health sans borders can help to break down not just geographic borders, but also sectoral boundaries and borders. And to this, we need to add that shared data infrastructure, not health-specific data infrastructure, is required. So let me conclude by noting that the contribution of data to better health outcomes is predicated on the assumption that we exchange data in a way that equitably shares benefits and respects the cultures and privacy of individuals and communities. If we fail to achieve this, exploitation will be the outcome, as sure as night follows day. Our aspiration should be to safely and responsibly harness the power of data together. And if we all individually attempt to progress within the confines of our own national and sectoral borders, we're just going to waste time, waste resources, and ultimately fail. So it's for this reason that I'm happy to lend my support to digital data sans borders and also digital health sans borders. Thank you. Thanks, Rajendra.